Hi guys, it's Dr. Perry Sexton over at Encinitas Family Care in San Diego, and today I'm going to talk to you a little bit about depression and anxiety. You see, I see a lot of patients who have been being treated for depression and anxiety by their psychiatrist or their primary care doctor even for years, and they won't really be able to tell me that much about what their experience is. Oh, I don't know, I just have anxiety, or I don't know, I'm just depressed, I don't have any energy, I don't know. And I really like to encourage patients to describe what their experience has been so that we can get to a better understanding of how we need to guide them through it and how we need to get them better. When we're looking at what medications, when we're looking at what kinds of therapy might be beneficial, really only looking at your experience is going to give us that guidance. So I want you to think about those. Now, whenever I personally think of depression for a patient, or whenever I personally think of anxiety for a patient, I don't just think of fear, and I don't just think of sadness. I think about exhaustion. You know, even when someone doesn't have depression and doesn't have anxiety, but you take them at the end of a tiring and stressful week, they are way more likely, if you cut them off as they're getting on the freeway, to have their heart start racing and say, holy cow, I can't drive the freeway home. I got to take city streets home. I'm going to die. Then if you do the same thing on a Saturday morning the next week later, because, oh, well, I guess they get to the beach 30 seconds later. Not such a big deal under those circumstances. But it's the difference in that exhaustion level. And, you know, there are so many other things that our brains cannot quite do. If I ask you to calculate the tip on a $57 dinner bill, do you 5 and then you carry the 1? Wait, do you double the tax and then you get the tip? You know what? Just give it $10. I don't want to think about it. That's kind of what our brains do whenever they're exhausted. We've all had that experience, even if you're not having problems with depression. Well, this is kind of what the depressed or the anxious mind experiences, but it's at a time when they are feeling overwhelmed by the things that are eliciting those emotions. And so that's what I want you to think of in terms of this.